Internalizing behavior refers to problematic thoughts and feelings, like anxiety, sadness, loneliness, and fear, that often go unnoticed and unaddressed in the classroom. Internalizing behaviors can negatively impact students' academic performance and well-being, especially when these behaviors persist because they make it hard to maintain focus and effort on academic tasks. Early identification of internalizing behaviors and immediate intervention by teachers is critical to meeting the needs of these students who may suffer alone and in silence. Anxiety is feeling worried or nervous, often about an imminent event or an uncertain outcome, but it may also occur for no clear, identifiable reason. Anxiety may co-occur with depression and attention deficit hyperactivity disorder, or ADHD. Some common signs of anxiety include sleep problems, not being able to stay calm, fidgeting, panic, shortness of breath, or nausea.
Anxiety is one of those double-edged swords that we all carry with us. Evolutionarily speaking, anxiety is a really adaptive response. It helps us look both ways before we cross the street, or look to see where our parents are when they take us to the park. It helps us study for tests and do our homework, and so it can be very adaptive, but on the flip side, it can also be very impairing. And some kids experience anxiety at a level where it actually starts to interfere with their ability to be effective in the classroom or in interpersonal relationships, or in other areas of their life. So if you, as a teacher, notice that students are experiencing some anxiety when it comes to things like reading aloud or other tasks, the first step might be to have to pull that student aside and have a discussion with them about their anxiety and that you've noticed it, and validate their experiences. Maybe talk a little bit about your own anxiety and how anxiety really is the body's alarm system, and sometimes it's calibrated correctly and it goes off, that alarm system goes off when it needs to, and sometimes it goes off when it doesn't need to, or when students aren't in a dangerous situation. And so validating that and then talking a little bit about what anxiety feels like for them. So do they get stomach aches? Do they get shaky? Does their heart beat fast? Do they feel like they can't breathe? What are some of the physical symptoms that they experience? Maybe talk about some of your own. And then talk a little bit about how even though that alarm system goes off sometimes, it doesn't mean that we have to avoid or escape, and sometimes things aren't as scary as we think they are. And then after you've had that conversation, one thing that I recommend is starting out by giving those students smaller tasks. So instead of reading a paragraph out loud, you might call on them for a yes or no answer, or you might have them read a sentence out loud, or you might have them do other tasks or other types of presentations or activities in the classroom that they have identified as being on the easier side of things, and then ramping up to maybe sort of the things that they might experience or at least perceive as being more challenging, so they can have successes along the way, build up their confidence and their motivation, but at the same time they're not avoiding or getting out of things, because you don't want to get into that kind of a pattern with kids, because if they learn that when they feel anxious they should escape or run away, that can spiral out of control.
Depression is feeling very sad, hopeless, or worthless. A depressed student may exhibit fatigue or irritability, frequently claim to be sick or refuse to go to school, exhibit attachment issues like clinging to a parent, or express worry or guilt about their life circumstances, such as the health of a parent or other loved one.
Depression is a bit of a tough nut to crack. So if you have a student who you think might be experiencing symptoms of depression, one of the first things you might do is approach that student and just have a conversation about things that you've been noticing. Are they more withdrawn during activities? Do they seem tired, like they don't have a lot of energy? Is their speech or their tone kind of flat? Have they stopped engaging in some of the activities or experiences that they used to engage in? If you start to pick up on this kind of a pattern, it's important to assess whether or not this is because they're not getting enough sleep at night, or maybe they're being bullied, or what else might be going on that may be leading to them experiencing this change in their affect and this change in their behavior. A lot of the times when kids are depressed, they're also kind of irritable. So if kids are breaking down more easily, they're getting really frustrated or teary-eyed, that can be a sign that they might be struggling a little bit with depression as well. Now, if it's an easy fix, like maybe having a conversation with them or their parents about sleep, or if they're being bullied, kind of identifying who the bullies are and rectifying that situation, then those are certainly steps that teachers can take. If it's something a little bit more chronic or severe and students are really having a lot of negative experiences, they have negative perceptions about themselves, the world, their situation, and they really are struggling, at that point in time, it might be worth setting up a referral with your school counselor or perhaps a therapist in the community to work on the depression.
First, understand that the symptoms of depression, which can often be challenging and frustrating in the classroom, are coming from somewhere and are there for a reason. Make effort to establish a connection with the student, perhaps outside of the standard class schedule, to understand their experience and build a positive connection, letting them know that you care about their safety and well-being. Next, help kids set goals for engaging in pleasant and positive experiences, such as social interactions or physical activity, or achieving small successes to help them shift their experience and mindset. Finally, make sure kids are getting appropriate professional support to address the issues underlying their depression and to address any risk or safety concerns. Somatization is when one experiences physical symptoms, such as pain or fatigue, that may be due to emotional distress. A student exhibiting somatization may frequently complain about headaches or stomach aches. Somatization frequently occurs alongside depression or anxiety. Start by understanding that the physical symptoms or complaints often stem from underlying stress, depression, or anxiety. Help kids to understand this connection as well, so that they can focus on addressing their stressors rather than focusing solely on the discomfort. Try to strike a balance between respecting the true pain and discomfort they feel, while also helping them find ways to cope with the discomfort so that it doesn't interrupt their other goals. That said, it is always important to rule out physical explanations for pain. So be cautious not to assume that all somatic complaints are psychological in nature, and make sure that kids are seen by a medical professional.
Somatization is a term that we used to use a lot in psychology. We don't use it quite as much, but it's just this idea that kids might be experiencing physical symptoms that don't really have any medical cause. And one of the biggest reasons for this in kids can be anxiety. And quite often it's something like a stomach ache. So maybe they have to be, excused to go to the nurse's office or excused for the day because their stomach is really upset. And so if you start to notice a pattern of this where kids are experiencing a lot of recurrent physical symptoms in the classroom, I would imagine at some point it would be helpful to have that discussion with the parents, make sure that they go see their primary care physicians and rule out some of those medical causes. And once those have been ruled out and those symptoms still continue, at that point, I think it's acceptable to have a discussion with kids about the physical symptoms of anxiety or the physical symptoms of sadness, to determine what it is they might be struggling with. And as is quite often the case, if it is anxiety, then you might want to work with that student to figure out when and where they are experiencing those symptoms. Is it all day? Is it before recess? Is it before lunch? Is it during spelling? Is it before they have to take turns reading aloud in front of the class? And if you can identify what some of those antecedents or what some of those triggers to the anxiety or to the physical symptoms might be, then you can work with those students to help them overcome some of that anxiety, to normalize that anxiety, and kind of work through it in a systematic way, where maybe you start with easier things and then you help them approach things that they perceive as scarier. You can also work with them to potentially provide them with a little more time on certain tasks if they need it initially, because they're getting nervous about not finishing in time, and then you can taper that off, and once they get some confidence built up and they start to have success with whatever the scary task or subject or what have you might be.